Hello, my name is Dalelkanova T D. I am an assistant of the Department of Children's Infection Disease, and today I want to demonstrate my lecture about polio infection in children. Plan of our lecture include the definition, etiology, epidemiology, pathogenesis, classification, main clinical manifestations, diagnostics, treatment, and prevention of this disease. Polio is one of the most dangerous diseases of the childhood, which can lead to death and severe disability. The polio or spinal infantile paralysis or poliomyelitis is an acute viral infectious disease which caused by polioviruses and characterized by the damage of the gray matter of the spinal cord and the sluggish paresis and paralysis. Etiology. The causative agents are RNA-containing small viruses, polioviruses from the family of enteroviruses genome, family of the picornaviruses. These viruses has the main three types, first, second, and third. First one is main in children and has cytopathic effect in tissue culture, and it's disinfected in 30 minutes when heated to 50 grades, but it tolerance to cold well. Also, these viruses are resistant to action of the digestive foods and the antibiotics. Epidemiology. The source of infection mostly sick child with any form of infection, it possible erased or inapparent form also. Transmission pathway mostly fecal oral, and the infection has seasonality, mostly summer and early autumn period when temperature outside weather is warm, and after illness by this infection, immunity is type-specific. Pathogenesis. Due to the fecal-oral transmission, the virus by fecal-oral route will enter by the mouth and then move to the intestine. There, they will find lymphoid tissue of the intestine where happens their primary reproduction. After that, they will spread to the blood and happens primary viremia. And by blood, infection will spread to the organs and system, sometimes can cross the blood-brain barrier and can cause serious meningitis, or will cross to the gray matter of the spinal cord and will damage any parts of our spinal cord or CNS cranial nerves, and from this depends of our clinical manifestation. And in the curing of this disease has the 4 stages. First of all, enteral stage, lymphogenical stage, viremia stage, and the neural phase also. Classification. Classified as a typical, atypical, and typical forms with central nervous damage, and atypical forms are inapparent and abortive. Typical forms can be non-paralytical, this is only one form, this is meningeal, and paralytical form can be spinal, pontine, bulbar, pontospinal, bulbospinal, banda, bulba, pontospinal forms. By severity, classified like mild, moderate, and severe. By the course of infection, like smooth and non-smooth, depends of possible complication and duration of disease. Clinical picture. Clinical picture of disease depends of the form. If it's atypical form, for example, inapparent form, inapparent means asymptomatical, when patient hasn't any symptom but had pathogen. Second one is abortive form, has numbers of the symptom, characterized by acute onset and mild catarrhal phenomena, moderate headache, and other intoxication symptoms, but it's atypical because duration of infection will be changed. If polio infection is long time infection, but there in the abortive forms usually recovery occurs in 3-7 days, means shorter. First form is non-paralytical and most mild form of infection where mostly paresis and paralysis not happen is meningeal. Meningeal form during as a serous type of meningitis, serous, aseptic, or viral meningitis, characterized by acutely onset by high fever, profuse severe headache, repeated vomiting, and the additional signs it's a forced position on the bed, photophobia, intolerance to bright lights, intolerance to the sounds, hyperacusia, general hyperesthesia, and the positive meningeal symptoms. Mostly this is stiffness of the neck, also Kernig sign, and the Brudzinski sign will be positive. The spinal form of infection is paralytical form, which has 4 periods: pre-paralytic period, paralytical, and the restorative period, and residual periods. First of all, pre-paralytical period. This form lasts from the onset of disease up to occurring paresis and paralysis. Mostly infection characterized by occurring of the sluggish or flaccid paresis and paralysis. Paralytical period of disease characterized by peripheral paresis and paralysis, peripheral flaccid, which characterized by hypotension, hyperreflexia or areflexia, and muscle atrophy or hypertrophy, and the lesion mostly asymmetrical, unilateral, but sensitivity in affected limbs will be preserved, and clinical manifestation of paralytical period determined by the localization of a CNS lesion. First and the main typical form of infection is spinal, characterized by the gait lesion when patient can't working by themselves, get failed all time, and mostly characterized by the unilateral asymmetrical lesion of the lower limbs, where happens skeleton deformities, muscle atrophy, and the motor function of the limbs will be disturbed. Next form of infection, also paralytical, called pontine. Pontine, characterized by defeat of the facial nerve nuclei of the seventh pair of the cranial nerves, characterized by the asymmetrical lesion of the face, and the function of the facial nerve innervated muscles will be disturbed. Patient mostly hasn't wrinkled one side eyes, has a ptosis, asymmetry of the face, and also a nasolabial triangle will be also different, can't closing the eyes, and etc. Next form of infection is one of the severe forms, called bulbar, characterized by the affecting of the nuclei of the bulbar group of nerve vessels. There are 9, 10, and 12, which answering for our swallowing, phonation, and feeding also, breathing also, and most of patient can't swallow and can't drink the just water, and can't feeding, has aspirate them, also can't swallowing, their phonation or voice will be changed also, and sometimes needs mechanical ventilation of the lungs. Very severe form. Next period of infection is recovery period, when active movements will be returned, but pay attention, active movements will appear first in that muscles which will affected less. If muscles affected more deeply in that limb, recovery doesn't occur. And these periods can last up to 6 months, sometimes more. Next one is the residual period. The remaining paresis and paralysis considered as residual phenomena, and after illness by this infection, most of patient has muscle atrophy, X shape, O shape, and other skeleton deformities, contracture, bone deformities, and etc. Differential diagnosis of polio infection at first will doing by neurological disease like polyradiculomyelitis, acute myelitis, and the polio-like form of enteroviruses. Diagnostics of the polio in children included non-specific tests like CBC and urine tests. There are no typical change, and the most main specific lab test, of course, is PCR for determine of the RNA of polioviruses. The best sample is the feces to all forms. If meningitis, liquor also must be checked, and also serological tests like reactive of passive hemagglutination and ELISA also can be used. Treatment. Unfortunately, there are no specific antiviral treatment against polio infection, and the purpose of the treatment include only improvement of the motor activity and increase of the muscle strength and volume of active movements of child. And they're mostly non-drug treatment, including the massage, physiotherapy, acupuncture, and etc. Drug treatment include only symptomatical treatment, and for increasing of the active movements, you can use protein, galantamine, and corticosteroids drugs and vitamin therapy, but effectiveness is low. And the tactics of future management of these children must to take physical therapy, spa therapy, massage, and the orthopedic prevention till the end of their life for increasing of the muscle tones and skeleton activity. Prevention of disease. Preventive measures included are active vaccination of children, and we use two types of vaccine. Both of them is compulsory. At the age of 4 months, we give vaccination by IPV, inactive polio vaccine. At the age of 18 months, it's first revaccination, and the second vaccine is OPV, oral polio vaccine. This vaccine is live vaccine we used at the age of 12 to 15 months. My lecture is over. Thank you for your attention.